Hello, everyone, and welcome to our webinar titled Integrated Care Partnerships in School Settings. We're going to get started in just a few. Let's give everyone the opportunity to get in and get settled, and then we are going to kick off today's session. Okay. All right. Again, welcome everyone, and welcome to our webinar titled Integrated Care Partnerships in School Settings, hosted by the Center of Excellence for Integrated Health Solutions. My name is Whitney Sarabor, and I'm a project coordinator here in the Center of Excellence at the National Council for Mental Wellbeing. Before I turn it over to our speakers for today, I just want to share a few quick technical tips and housekeeping items to ensure an engaging and interactive session today. First, we want to encourage everyone to explore your Zoom toolbar, where you will find icons for the chat box, the Q&A box, and live transcription. We encourage you to enter any questions and comments you have at any given time throughout the session, since we will be monitoring them very closely and responding. We hope that the box will serve as an interactive space to share strategies, ideas, and resources related to our topic today, so I encourage you to check it frequently. Also, you can expect to receive slides and recordings for today's session by email tomorrow afternoon, and you will be able to have access to all the materials on our website also tomorrow afternoon. Also, I just also wanted to quickly announce that our office hour for this webinar will be taking place on Thursday, and you will find information to register in the chat box that will pop up soon. So please register if you are interested in having some questions answered for our office hour happening Thursday. It's going to be from 1 to 2 p.m. Next, I would like to share this brief disclaimer here. As previously mentioned, today's webinar is supported by the Center of Excellence for Integrated Health Solutions, which is made possible by a grant award from SAMHSA, the Substance Abuse and Mental Health Services Administration. There is a slide included with a few more details on the disclaimer here, and if you have any questions at all about SAMHSA or the work that we do within the Center of Excellence, we will be sharing our email towards the end of the session today, so you can get in contact with us. So now I would like to kick off our first poll questions. We only have 3. We just want to get to know our audience here today. So we'll give you a couple of seconds to answer the first poll question. What describes your role? Are you a clinician, administrator, policymaker, payer, or other? And please specify in the chat box if you select other. So in just a few, I'm going to close this poll and share the results, just so that we all are aware of the people in our space. Okay, closing it now. Okay, so it looks like a majority of us are administrators with 45%. We have 20% who are clinicians. 29% chose other, and hopefully you specified what the other is in the chat box, and then 2% are payers, 3% policymakers. Okay, let's move on to the next one. And question number 2 asks, what best describes your organization? So let's take a couple of seconds to answer that as well. Are you a primary care provider, mental health provider, substance use disorder provider, or other? Again, please specify in the chat box what your other is. So in just a couple of seconds, I am going to end this poll. Okay. All right. So poll is closed, sharing the results now. We have, it looks like 56% who are mental health providers. That's the majority. We have 43% who selected other, and hopefully you specified in the chat box what that other is. We have 22% who are substance use disorder providers, and we have 11% who are primary care providers. So thank you for answering those questions. We have one last question here. And I'm gonna launch it. All right, so this, the last question asks, where is your organization in the process of integration? Are you in the learning and exploring, beginning implementation, advanced or full implementation, ongoing quality improvement, or other? Again, you know what to do. If you select other, please specify in the chat box. And in just a few, I am going to end the poll. Okay, closing the poll now. And sharing the results. So it looks like a majority of us are in the ongoing quality improvement phase. And we have 22% who are beginning implementation, 20% learning and exploring. We have 12% who are in the advanced or full implementation. And we have 12% who selected other. All right, so thank you everyone so much for participating in this poll. And in transitioning in today's session, I would like to introduce our speakers for today, and they are all from various organizations who all support and are part of the school-based health programs. We have first Katie Stinchfield. She is the Director of Behavioral Health Programs for the School-Based Health Alliance. She has also been the mastermind and organizing this webinar and bringing all of our speakers together. So thank you so much, Katie. We have Jamie Martens Perry. She is the Director of Youth and Family Support Services for Chestnut Health Systems. We also have Amy Hill. She is the Vice President of School-Based Services for Bureau Behavioral Health. Last but not least, we have Michelle Thiesfeld. She is the Director of School-Based Services at Season Center for Behavioral Health. All right, so I'm going to turn it over to my colleague, Paula Sirimba. She's going to go over the agenda and some other items for today. So over to you, Paula.
Thanks so much, Whitney, and thank you everyone for joining us. I wanted to just give a warm welcome from the Center of Excellence for Integrated Health Solutions. And this is our agenda for today. So it is packed. We'll do some more welcome and introductions. Katie Stinchfield will share more about the School-Based Health Alliance and also about a recent project that the School-Based Health Alliance undertook that explores strategies that community mental health and substance use treatment organizations, including certified community behavioral health centers, can use to build successful partnerships between local schools and community health centers. Towards the end, we'll share some announcements and resources, and we do encourage you to come back and see us again on Thursday from 1 to 2 p.m. Eastern Time for an open conversation and office hours. So our learning objectives are also on the screen. Thank you, Whitney. So at the end of the session, it's our hope that participants will understand the value of integrated care in school settings, that participants will recognize current trends in mental and physical well-being of youth across the country, and gather suggested strategies and ideas from leaders of community mental health and substance use treatment services, including CCBHCs, for improving partnerships with school-based health settings. And we also hope that you all will understand some key considerations for building partnerships with schools, including school community integration, workforce development, sustainability, and ongoing collaborations. So I'll turn it over to you, Katie, to introduce more about the School-Based Health Alliance.
Thank you so much, Paula, and everyone on the National Council team. As Paula said, I'm Katie Stinchfield, Director of Behavioral Health Programs at the National School-Based Health Alliance, and I'm so pleased to share some about our work. The School-Based Health Alliance, or SBHA, works to improve the health of children and youth by advancing and advocating for school-based healthcare. We believe that all children and adolescents deserve to thrive, but too many struggle because they lack access to healthcare services. School-based healthcare is the solution, bringing healthcare to where students already spend the majority of their time, in school. When health and education come together, great things happen. Attendance improves, conditions like asthma or diabetes are better managed, behavioral health issues get quick expert attention, and we all know that healthy students make better learners. Since 1995, the School-Based Health Alliance has supported and advocated for high-quality healthcare in schools for the nation's most vulnerable children. Working at the intersection of healthcare and education, the School-Based Health Alliance is a recognized leader in the field and a source for information on best practices for philanthropic, federal, state, and local partners and policymakers. Our focus includes policy, standards, data, and training to support and grow school-based healthcare, particularly school-based health centers. Please visit our webpage, subscribe to our digest, and follow us on social media to learn more. Back to you, Paula.
Thank you so much, Katie. And so on behalf of the Center of Excellence for Integrated Health Solutions, we wanted to ground today's conversation a little bit in why we are focused on integrated care as the Center of Excellence. So there's some information, some data here that helps explain that adults and children with physical health needs who access care in physical health settings are likely to have significant co-occurring mental health and/or substance use challenges. And vice versa, adults and children with mental health or substance use challenges who access care in behavioral health settings are likely to have significant co-occurring physical health challenges. So we're talking about the mind-body connection here and how healthcare and community care providers can address whole person health needs. And today, particularly for students in the school age range. So failure to address co-occurring conditions in either setting, in primary care, physical health care, or behavioral health care settings, in an integrated manner leads to poorer outcomes, including decreased lifespan and higher costs for all affected populations. Health inequities are more likely to be experienced by populations with co-occurring conditions who also have challenges and disparities due to cultural, racial, and linguistic barriers to care, as well as experiencing social determinant needs like housing instability and food insecurity. So integrated attention to all of these complex challenges is needed to promote wellness and equity for those most in need. So if we move on to the next slide, I'll share a little bit more about the Center of Excellence for Integrated Health Solutions. We exist to advance integrated care through training and technical assistance. And so we are hoping to advance implementation of high quality evidence-based treatment for those individuals with co-occurring physical and mental health conditions, including substance use challenges. And we provide training, resources, and technical assistance, such as through today's webinar and Thursday's office hour. So thank you for joining us. Thank you for tuning into today's session, and I'll turn it back to you, Katie, to share a little bit more about the connections between integrated care in school settings.
Thank you so much, Paula. School-based mental health programs and school-based health centers promote optimal health and well-being for young people right where they are at school, as we've said. So at the School-Based Health Alliance, our focus is on the school-based health center model, or SBHCs. SBHCs deliver integrated primary care, mental health, substance use prevention, sometimes oral health care, vision care, dermatology, and other services to promote optimal social, emotional, and behavioral health of students, as well as to minimize the effects of poverty, chronic disease, adverse childhood experiences, and other social determinants of health and their effects on school success. SBHCs offer high quality mental health care by using an integrated strategy for addressing health and mental health issues. Several studies have shown that the barriers experienced in traditional mental health settings, stigma, noncompliance, inadequate access, are overcome in school-based settings. And in studies of SBHC service utilization, mental health counseling has been repeatedly identified as the leading reason for visits by students. A national survey of SBHCs found The following mental health and counseling services are typically provided at integrated care SBHCs: crisis intervention, referral to crisis services in the community, mental health assessment, grief and loss therapy, substance use prevention and treatment, mediation, and among a variety of other services. School-based healthcare is a powerful tool for achieving health equity among children and adolescents who unjustly experience disparities in outcomes simply because of their race, ethnicity, or family income. Next slide, please. So circling back to why this all matters, we all know that the mental well-being of young people in America is suffering. The Centers for Disease Control, CDC, Youth Risk Behavior Survey results recently found that high school students experienced a 40% rise in persistent feelings of sadness or hopelessness between 2009 and 2019, before the COVID-19 pandemic. The pandemic exacerbated youth mental health issues, with new data from the CDC showing that more than a third of high school students reported experiencing poor mental health during the pandemic, and nearly half said they experienced persistent sadness or hopelessness over one pandemic year. 2021 data from the US Department of Education confirmed that a disproportionate number of African-American children received more than one out-of-school suspension in preschool, and overall in kindergarten through grade 12 are suspended 3 times more and expelled 1.9 times more than white students. Black, Indigenous, and youth of color are more likely to be directed to juvenile justice systems than specialty care services for behavioral and mental health challenges. Young people found that substances like alcohol, tobacco, marijuana, and other illicit drugs were 4 to 11% easier to obtain during the COVID-19 pandemic. Substance use was an outlet for many young people who felt isolated from friends and social support, and those who had to battle depression on their own and in sometimes toxic households. According to the 2019 CDC survey results from 13,677 students, more than 7% of high school students have been threatened or injured with a weapon, for example, a gun, a knife, a club, on school property 1 or more times during the 12 months before the survey. From the K-12 school shooting database from the Center for Homeland Defense and Security, between 2000 and 2021, the number of school shootings with casualties per year at public and private elementary and secondary schools ranged from 11 to 93. Next slide, please. So I know that that's all, I imagine for our audience, not surprising to hear, but still not good news for the young people we serve. And yet, there are effective solutions to support youth mental well-being. We know that young people are more likely to access mental health services in schools than anywhere else by a landslide. And youth with strong school connections show better mental health, as well as social and academic outcomes overall. Unfortunately, years of insufficient staffing, high needs, and the more recent pandemic fatigue have overwhelmed our public schools. Our education partners are tapped out. The hyperlink on this slide that lists education partners being tapped out links to America's School Mental Health Report Card, a recent first ever national report grading every state in the country on policies that support school mental health, with recommendations so that every state can take further action to help their children. Spoiler alert, most schools are failing at these standards. Very few meet them. Community partnership is the solution, whether via a full-fledged school-based health center with integrated care or a comprehensive school mental health program. Communities that are collaborating on school-based mental health solutions can significantly impact the well-being of young people. Next slide, please. That's why the National School-Based Health Alliance is so proud to partner with the National Council for Mental Wellbeing's Center of Excellence for Integrated Health Solutions to bring you nationwide case examples and strategies that highlight the work of community behavioral health organizations providing quality mental health services to young people where they are in school. We spent the past year working with community behavioral health organizations, including CCBHCs, mental health provider organizations, and integrated care organizations from across the country to develop a resource for other community behavioral health organizations or integrated care organizations to partner with schools to deliver quality care to school-aged children in the school setting. Next slide. The resource we've spent the past year developing will be released later this summer, but our webinar today will capture some highlights. The major themes that we encountered include recognizing the value of school-based services, understanding why they're important, forming partnerships, how to get your foot in the door, maintaining school community integration, building out the workforce, which is a challenge everywhere these days, sustainability, keeping your program viable and financially and value-wise in the community, as well as ongoing collaboration. I want to take a moment to acknowledge the amazing time, effort, and expertise shared by all the individuals and organizations around the country who participated in the development of this resource. We have loved this project and so enjoyed learning from all of our different experts who contributed. You can see all the organization logos here, and we will hear from a few of them now. I'd like to welcome our incredible speakers who worked on this project. We were only able to highlight 3 today. Like I say, we worked with 12 total, but we're so looking forward to hear about their school-based health programs. So without further ado, I would like to pass it to Jamie Martens Perry from Chestnut Health Systems to share about their program.
Hello, everybody. Good afternoon. I have the privilege of talking about my mental health school-based program. I am located in Illinois, and our agency is located in Granite City, Illinois, and Belleville, Illinois, which probably means nothing to most of you, except that we are about 15 to 20 minutes outside of St. Louis, Missouri. So we do have a pretty good amount of resources right over the river, but I don't know if any of you work closely to another state. It's like that on that side of the river, they do their own thing, and on our side, we do our own thing. So although there's many resources 20 minutes away, insurance providers, they often don't play well together. So we had to figure out some resources of our own on our side of the river. So I would say about 7 or 8 years ago now, I was running into, so I'm the director of all the youth services. And so we were running into some issues, obviously, where clients weren't coming into the office, particularly youth. And I thought, well, this is just silly. Kids are supposed to be at school. And so I began my journey and started with one who I call like a mental health champion embedded in a school. And I had worked with her on many crisis calls. It was a behavior disorder school. And we chatted about how awesome it would be if I could just give her a therapist, one of my therapists who was office-based. And I just said, can I just move her into one of the office spaces in your school? And she said, well, that's a great idea. And she was the principal at the time. And so it was sort of like a pilot. And this was back in 2014. And so we moved that one staff in, and she provided mental health services, much like you would in an office-based setting, to the youth at the school 3 days a week at that time. We quickly realized that more of the kids needed services. The parents were really happy that services were able to be provided at the school exactly as they would at the office. The parents were more willing to engage because that's where their kid was. And when they needed to go to IEP meetings or just meet with principals or teachers, then my staff was also there. So that they could, it was kind of like a obviously integrated but holistic approach to the youth, not only school needs, but mental health needs as well. And so that grew for my agency back in 2014 with that one staff to now we're serving or providing services. So I have a therapist embedded into around 44 districts, both in Illinois and Missouri. So I have a total of 59 staff that we provide. So Chestnut is their employer, and then we provide them to schools. And so most of the time, my staff are seeing clients who have the state medical card. And so we're able to bill those services still being on site at the school. So the services that are provided mostly are, we ask the schools for a few things from them. Private space in which to provide our services, Wi-Fi access, because documentation is key, and we have to document in our electronic medical record system, and then referrals. So this is where we get our clients also. So based on the school's need is how many days a week we are embedded in their school. So it may be a smaller school and they may only have 100 students and they think, oh, maybe we'll have 8 to 12 referrals. And so for me, that turns into a day of my staff providing services. The services look like they would at the office. However, they are more time specific, dependent on the school's availability and schedule. And so if we're talking about a K-3 school, that's littler kids. So my staff may only be able to spend 20 to 25 minutes based on the client's availability and the client's ability to engage for that long of a time. So then we all the way up to high school level, we will get to see clients for 50 minutes at a time based on the class periods. So that typically my staff are seeing around 8 to 10 clients a day, depending on the timing again. Some of our districts make it really nice and create that schedule for us so that we do all the consents at the beginning when we do the assessment and the treatment plan. And then the parent allows us then to talk to the school, and then we provide them with our consent. And then we can have that really interactive relationship. A lot of my staff have either monthly or bi-weekly meetings with the social workers at the school buildings so that everybody kind of knows what's going on. We all try to use the same language. And if we're working on specific self-regulation skills, then not only is my therapist using the same verbiage, but the teacher is, the administration is, and also the social workers. So it's really nice for the kids to be hearing a common language, and really nice for parents who then also can use that common language after a lot of times we'll have family sessions, not just individual sessions, where we will invite the parent either to the school. Now with COVID, that was difficult. They didn't want more people in the buildings. So a lot of times we were doing Zoom sessions where we might have the client in office with us at the school, and then the parents would attend via Zoom or just the phone. What I have noticed is that we can get parents much more on board and engaged than we were able to versus office space. So sometimes the parent would just bring their child, and it was maybe seen as, 40-45 minutes of time for them, peaceful time. So this, I feel like we can engage parents a little better because they're just used to coming either to the school or being okay with hopping on a Zoom while we're meeting with their child. Do you guys want me to do answer some of the questions?
Jamie, I'm seeing some great questions. I think we'll hold off for now.
Okay.
Yeah, with just maybe just a couple more minutes on your programs, kind of the need you saw, and actually the spread of your services now. I know that you guys are working in an impressive number of schools.
Sure. Yes. So the need obviously is based on school or district. And what I will say, I know Katie and I had a conversation about this. It was just like we started in one school back in 2014, and when we saw the need, and then it literally spread like wildfire. So it was like this principal talked to this principal who was, then I'm friends with this superintendent. And it was like, do you have a Chestnut? No, we don't have a Chestnut. Well, you need to get a Chestnut. So it was like really quickly, we expanded. Back in 2015, I had 19 staff total in my youth and family support services program. And I fast forward to now, we're at 59. So it made one staff may be embedded in 3 schools because maybe they're only there a day or 2 a week. Or I do have staff who are embedded in, let's say, our larger high schools or our larger middle schools the entire week. So one staff, then their office space is just, let's say it's at Belleville West High School. And that staff is there all 5 days a week and typically carries a caseload of about 45 to, I'll say 60 is max, clients that they're seeing on a weekly basis. And then depending on how long we see them, it could change. Maybe you need, you move down to every other week and then we get to discharge successfully. And so then we take more referrals. I will say one of the issues that we have been running into, I guess we're still we're still in COVID, but I think our numbers have greatly increased for youth who are experiencing anxiety or depression post-COVID. If it could be post-COVID, it's not yet, but I feel like our numbers have increased. And so schools have asked us, I know that we already have somebody full-time, but can we have another one? So the need is so great. So I guess we're in 44 districts, which cover, I think we're a little over 100 schools, maybe 102 schools, because one district may, of course, have 3, 5. I mean, we have one district that has 19 schools. So just trying to figure out how to make sure that we can cover the need with the staffing pattern, because as a lot of you know on this call know, it isn't a easy task to find therapists current time. I will say 5 years ago, I didn't have this issue. But I'm, now I have a grant. Specifically, a school asked, can you provide us with two more therapists? We already have 2 embedded in their district and they see a need. And so we've posted those positions, and I don't know that we have had any applicants in the last couple of weeks. So I think most of you on this call can understand and appreciate the lack of applicants, but I'm really hopeful. Somebody's got to love this work as much as I do. That's how I see it. So
absolutely,
hopefully I'll get those applicants.
Yeah, and you're certainly in good company on this call today, Jamie. I will say this so broadly, just to kind of echo what you were saying. All of these programs around the country look very different. So some of the questions rolling in are all questions that we encounter all the time. And we will definitely, if we don't get to answer these questions today, we will do our very best to address them in the office hours. And again, we've got this resource coming out a bit later in the summer that will address a lot of these questions too, as well as reaching out to, any of us on this call, School-Based Health Alliance, National Council, we're happy to help. Universally, what was a common theme from every single site was that workforce issue, Jamie, that it's just so hard to get staff anywhere right now. I want to keep an eye on the clock. I know there are lots of questions, but maybe we can, thank you so much, Jamie, for sharing. If there's time at the end, we'll do a few questions, but I'd like to move on to Amy from Bureau of Behavioral Health now to share some about her incredible program. Thanks, Jamie.
Hi, my name is Amy Hill. I am the Vice President for School-Based Services at Burrell Behavioral Health. Burrell is a fairly large community mental health organization. We're actually also a CCBHO. We serve 18 counties in Missouri. We recently merged with another agency that allows us to, we don't have all CCBHO counties, but we do serve a lot of other counties in Illinois and Oklahoma and Missouri as well. And so I have a lot. Yes, Jamie, you're in very good company. I loved that you said, surely there's other people that love this work as much as I do. I am one of those persons. And so I'll look forward to connecting with you more. So I'm going to talk through just a little bit about our school mental health program today. So we always kind of start our conversation talking about why school mental health is so important. And Jamie shared some of those reasons before, just some of her experience, very similar with ours. So on the next slide, you'll see a lot of data from our state. And you'll see that this comes from our Department of Mental Health in the state of Missouri. We have a Department of Mental Health that produces a student survey every 2 years. It gives us incredible data to really know what's going on with our students in our state. Obviously, it covers a lot of mental health and behavioral health issues, but really it covers a lot of different topics. And so what we've been able to find from that survey, the most recent results we have are from 2020, which, as we know, was an interesting year, the start of the pandemic. But we know that about 33% of all of those middle school and high school students report just feeling very sad. So I always say it's not like, hey, I know what sad feels like. I feel very sad a lot of days. 45,000 students are struggling with anxiety. And we also know that 50% of all lifetime cases of mental illness, they are going to begin by the age of 14. Having said all of that, what it also looks like in the next slide, you'll see that right now there's an 8 to 10 year delay in the average delay in the beginning onset of a symptom to the first intervention. I spend a lot of my days as the vice president for school-based programming talking and working with school administrators. You'll hear a little bit more about just the depth of our program here in a minute, but I visit with school administrators oftentimes on a daily basis. And I always kind of say it like this: that's like a kindergarten student showing signs and symptoms of cancer, but seeing the oncologist for the first time in the 8th, 9th, or 10th grade. Really, that's kind of what it looks like. We know that physical care is oftentimes more attainable for youth than mental health is, but we also know that 1 in 5 students really are struggling with a mental health issue in and out of the school every day. You know, Jamie mentioned a lot of things about how it's so much easier for kids to get treatment in the school setting. And we know from the National Center for School Mental Health that about 80% of all kids who are ever going to get a mental health intervention ever in their life are going to do so in a school setting. And that's why we're so passionate about bringing our school-based services to our local community school partners in order to really be able to try to meet that need. I heard Jamie say numerous times, the need is so great. And that is something I say all the time as well. We have a vast, huge, great need for mental health resources for our youth. And really the best way we can connect with them is through schools. So I'll tell you a little bit about our program. In the next slide, you're going to see that we really have just a whole school approach. We have a 3-tiered approach here. And our tier 1 is for prevention training and consultation. And, you know, we know that 20% of youth are struggling with a mental health issue, but 100% of our kids have mental health. And so we want to make sure that we are reaching and providing resources, not just for those kids that are struggling day in and day out and can't function in the classroom, but for all kids. We all humans have mental health that we have to take care of. And so we have a pretty vast, expansive program where we do a lot of training. We train a lot of teachers, a lot of administrators on really what is best for kids when it comes to mental health. We offer the same sort of services that Jamie offers. We offer a lot of targeted groups. We do that for both adults and for students, and all of this is in the school setting. And then we're also able to provide one-on-one intervention for kids that are tier 3 through just different providers, embedding our providers directly into the district. And through COVID, we learned a whole lot about what we can do via Zoom as well. And we're also able to connect a lot of kids with psychiatric care. At Burrell, we do have an integration department. We do work on really looking at trying to integrate people with primary care as well as mental health. And so those are conversations that we're continuously having, is how do we really address that whole body, that whole student, and look at being able to connect with referral sources or on-site providers and those sorts of things with integrated care as well. So again, on this slide, you're just going to see kind of that tier 3 intervention and support that we also provide that I talked about before, which is just, we want to make sure we have a universal approach where we're working really on prevention. You know, tier 3 is much more intervention focused, but we are really also amping up our efforts for prevention through a variety of prevention models. We use sources of strength. We use a variety of drug and alcohol prevention that we are trying to really just explore what areas of need are there in our local school partners and how can we meet that. This next slide really just kind of goes over our school-based department in general. So in the state of Missouri, and I see a lot of questions about funding and those sorts of things. And I appreciate that Katie said that this is a national webinar, right? And so each state is a little bit different. And so what you might find one state utilizes in regards to funding, another state might not. But so in my state, in the state of Missouri, there were some just different rules and regulations about funding, and really school-based services was limited in what we were allowed to do until about the year of 2018. And that's really when we launched this partnership, this program at Burrell, our school-based program. And since then, we have seen just massive explosive growth, similar to kind of what Jamie had shared. We do serve 70 school districts. We serve some of the largest school districts in the states that we partner with, as well as some of the smaller ones. You know, we've got 25, 30,000 student districts, and we've got districts that have 111 kids K through 12. You know, it really just kind of depends on the area. We've seen over 10,000 referrals made to our school-based program, and those come directly from the schools, from school counselors, school administrators. We've got about 5,000 youth right now enrolled in our school-based services programming. And we've had over 25,000 professional development contacts. It talks a little bit just about our training. We've done a lot of training over the last 4 years, and we're currently right at about 250 employees that serve our school-based department. And out of that 250, about 200 of them are direct care providers that are in and out of our districts every single day. We've also had the opportunity to provide some conferences, both at the state and the national level. Again, our training program tends to be somewhat comprehensive. I do see some questions about covering insurance. And one thing that's great about working at a CCBHO, which is a community, a certified community behavioral health organization, is that we are also able to partner with SAMHSA. We talked a little bit about SAMHSA here too. So we certainly look at billing all funding sources, but because we are a community mental health center, we explore a lot of grant funding, whether that is through local organizations, you know, local people, local donors, state opportunities, and certainly grants that come from SAMHSA and the federal government as well. So that is just kind of our program in a nutshell, and I'll turn it back over to you, Katie.
Thank you so much, Amy. You guys would all be astounded at the professional development offerings that Amy and her team at Bureau have put together. So again, flagging our resource that will come out shortly, we'll be able to share her menu of those services and a huge array of other resources. Thanks so much, Amy. And now we will hear from Michelle Thiesfeld from Seasons Center.
Hi, I'm Michelle Thiesfeld. I'm an outpatient therapist here, but also the director of our school-based mental health services at Seasons Center. We are a community mental health center, also CCBHC. So if you want to keep going through slides, that'd be great. We cover Northwest Iowa. We currently have 9 core counties that we provide services in, that we're the community health center for, but we provide services directly in 20 counties, and that's not including people that just happen to come into our counties to access services, but we do have offices of some sort within 20 different counties. So next slide. We have some different programs at Seasons Center that are really focused on the youth, and that's where some of these other programs have come from. We have our Autumn Center and Camp Autumn. They are named after a young girl who was abused in her daycare center and ultimately passed away from that. So we've done a lot of outreach and centered some of that on her to develop some programs to help with other individuals and youth to make sure that they're getting the services that they need. And that is where some of our school-based services have come in, is how to offer more accessible services to kiddos. Next slide, please. That is just some pictures of our Autumn Center. It is our youth-based facility in one of our locations. Very focused on evidence-based practices for them. And then we have our Camp Autumn. In the summer, we provide camp programming, a therapy camp. Individuals that attend have 2 days a week that they receive group therapy and 2 days a week that they receive skill development. It's funded through grant funding, and it's on location where we have a pond and we have just different resources. It's a fun little site. So if anybody has any questions on that, we can certainly provide more information. But next slide. So our school-based mental health services are within some of these counties. This was an additional slide that got added. I apologize, kind of same as what we already talked about. So you can go to the next slide. Our school-based programs, I took over our school-based programs in 2020. It had started fairly small with one skill-based service. We live in the middle of nowhere up here. And so some of our schools, and a lot of our schools are combined. And so to access services, kiddos were driving sometimes an hour to an hour and a half one way to get therapy. And so then they were out of school for full days. And as we know, some of our most at-risk kids with mental health needs are also most at risk academically. And so having them out of the classroom and out of that controlled, safe environment was creating a lot of harm. And so we put together some different programming to help with that. So in our school-based program, we tried to provide two different services, our therapist and our youth service worker, which is our bachelor's level skill provider. Next slide, please. In this, what we offer, our therapists can do the same things that they do in the office. They do the mental health evaluation, providing different diagnostic information, and then developing treatment plans with the family, with the individual, and involving the school when needed to help with that. So the individual therapy is happening. We focus on EBPs. I know somebody asked about those. I think it's the same EBPs that everybody's focused on, your DBTs, your EMDR, your trauma focused CBT, your all of those. They also can provide group therapy as well as our skill-based therapy program. And as was mentioned before, every state calls it something different. In Iowa, we refer to it as BHIS, Behavioral Health Intervention Services. And so that individual is on site as well. We focus on education for the classroom and for the school district as a whole. We provide a lot of different collaborative meetings, finding it very important to have everybody come around the table to help serve some of these kiddos so that we can be sure that everybody's getting needs met, not just in one setting, but wanting to make sure that it's covering all areas, whether it be needs from home, needs from the classroom, needs from different services. So if DHS is involved, or if juvenile court services are involved, or maybe it's a kiddo that we're not understanding why they're not coming to school, somebody else may have information on why they're not. Maybe there's a hole in their roof and they're not getting a lot of sleep because it's snowing inside their home. And so we can work together to find people that can come in and maybe patch that or repair that. So finding those collaborative meetings to be important, as well as attending IEPs, as was mentioned before. So different social emotional needs that we focus on: anger management, impulse control, communication, problem solving, attention, listening. These seem to be the ones that we're hearing from the schools, and wanting to help them kind of create a balance between classroom management and what is mental health need. So doing some education and then providing them resources as well as the tools that we're working individually with the students on. Next slide, please. A lot of this information we've heard already, and so I'm not going to make everybody listen to it again. We all have shared information, so I'm not going to just read through that. But one of the big things with school-based services and why we've partnered with schools, and I say partnered because we develop a partnership with them, and I think it's really important to know that in order to provide the most effective care, what we have found is really having that partnership. As a clinician, I've done the process of going in and providing services in the school and having a space that you could go in and do that. But when you develop that partnership, what we have found is if they have some ownership in that as well, schools find, we have found schools to be more open to wanting to make sure that the resources are there and they're available. So we provide therapy 40 hours a week in the school setting with that partnership. And so there is that space that's accessible, and then we are able to provide more timely and efficient services to all of them. One of the questions that came up when we did the initial talks was, how do you form those partnerships? And I think that, when I go in and talk with schools and I have those conversations, I really focus on how we're a team and that need to work together, because they know the school side and they know academically what those needs are. And we're coming in saying, oh, hey, we're going to look at this in a mental health side. So when there's behaviors in the classroom, yes, there's classroom management, but we're saying, hey, let's understand why that is. And is there some trauma that's happening? And how do we develop that understanding? And so to do that, all of those meetings, we really focus on making sure that we are developing programs together in the school, developing their MTSS or PBIS models together so that we can have a say in that, and they can also help us understand where they're coming from academically. Because I think some of the challenge is, why are kids being taken out of a class, or why are they having to leave to go to these services, when we can help say, hey, we're going to do this together, has really been rewarding on both sides, because it helps providers understand what's happening in the classroom and why, compared to when a kiddo just comes in and shares information, we're able to have more of those conversations. And we also want those counselors and different administrative people to understand we're not here to take over. We want to do this together. We want everybody to have a say in what this looks like so that everybody is working together. And I think that that's the biggest approach that we have taken, is making sure that everybody is working together, whether it be from the school side or from the mental health agency, to know that the needs are being met. So those are just some of the different things that we've done. We've also found that the more that we are getting involved in the school system as well as the community, the more that people are open to mental health services. So trying to take away some of that taboo nature about mental health services has been huge for us. So we try to do back to school or end of the school year carnivals at the schools, that we are able to provide resources to parents, provide education. We hold different meetings throughout the year that parents can come in and learn about different topics. We use a lot of surveys where parents, community members, teachers, students can say, hey, I want to better understand this. And then we can put together different trainings that we take into the school or hold community trainings to help educate and provide that information. Yeah. The other thing, you know, as I've heard the other two talk about, was that workforce and how do we get providers? And that's a challenge. And especially when you're in rural Iowa, it's a challenge because there's not a lot of draws to those rural communities sometimes. And one of the things, you know, we do have the National Health Service Corps grant, which is helpful for individuals looking for tuition repayment. And so that's always something that we want them to look at. But also, you know, we, as an agency, just focusing on that self-care, the productivity is different in a school. I know there's been a lot of questions about funding and how do we pay those. With our partnership with the school, they pay a fee that is, or I don't want to call it a fee, but their portion of the billing is for us to be able to be involved in those meetings, which then also lowers their productivity. And so then with our productivity numbers, those are lower, and that has helped with burnout for people because they're not required to see as many people in a week. They can focus on quality care and also on that integration within the school system. And so I find those to be really helpful in some of that workforce development. And what we have also, we have an internship program here, and that is bringing people in, and younger therapists seem to be more interested in that school development piece. And so that has been helpful as well. Also wanting to make sure that they have all of the resources they need. So we work with the schools to establish some pretty significant sensory rooms that are not just designed for specific diagnostic needs, but a therapeutic sensory room as well for calming and providing more of a trauma-informed space for that also. Trainings for EBPs, making sure they have the equipment they need, specifically EMDR, you know, your light bars and your buzzies and the different things that they need for that as well. So I think I kind of hopped around, but we do a lot of communication with administration, with the school boards, providing information to them about what services we provide and what numbers are looking like for the year, because I think the more communication that we have, the more involved and informed schools feel. And so I think that that is important. We do work with grants to help fund some of those programs as well. Next slide, please. And then, yeah, so I feel like I talked really fast because I kind of had a time limit, so I apologize. Probably wasn't as fluid as I should have been. One area I did forget to mention is through, we also provide mobile crisis. And so our mobile crisis comes in and helps at the school beyond what our therapist provides. We have a couple other programs that help with some of that. So I apologize. That's it.
No apology necessary, Michelle. Thank you so much. As you have all seen, some really incredible programs around the country. These lovely ladies who shared today, as well as the other programs that contributed to the resource that's coming out later this summer. Again, we are very low on time today. I saw many great questions that, again, none of which probably surprised any of our speakers or myself regarding how to get school-based mental health programs up and running, to partner with your school-based health center or your school, working on funding, privacy laws, all of those things. We have been down that road many times. So we would love to have you join us for our office hours session. I believe it will also be recorded. So if you can't be there, you should be able to access it later. And again, huge thanks to everyone for joining us. I will pass it back to Paula and Whitney. Thank you so much for all you do.
Awesome. Thank you so much. This was a really great session. We've got a lot of great questions, so we're really looking forward to the office hour coming up on Thursday. So without taking any more time away, I would like to begin to close today's session. So first, I want to thank all of our speakers, Katie, Michelle, Amy, and Jamie. Thank you all so much for joining us and leading this discussion for integrated care in the school settings. We also want to thank all of our participants for being here today and being part of this important discussion. So for use at your own discretion, we have some references and resources here that you can use to dig deeper and to get more information on how to begin the implementation in your own organizations. Additionally, we also want to flag some of our upcoming Center of Excellence events. As previously mentioned, the office hour for this webinar will be happening this Thursday from 1 to 2 p.m. Also, the COE will be hosting part 4 of the perinatal health webinar series. That's happening on Thursday, July 21st from 2 to 3 p.m. And it's focusing on addressing serious mental illness. So also we have the part 4 of the CHI webinar series, which focuses on payment models for comprehensive health integration, and that's also taking place Wednesday, July 27th from 1 to 2. So feel free to register for any of these upcoming events. Also, if you are interested in individual consultations, please feel free to reach out to us, go to our website, or also you can click the link on this form here. If you're looking for free trainings or credits, you can also reach out to us there. And that will conclude our presentation for today. Feel free to send us an email if you have any questions, and we look forward to seeing you during the office hour or any of our future events. So thank you so much. You all enjoy the rest of your day. Bye.